we're checking back in with Dr. Robbie Goldstein, Democratic candidate for the 8th Congressional District here on the South Shore, to find out how the campaigning has been going. Doctor, nice to see you again.
Great to see you as well.
Thanks for spending some time with us. We had chatted. It's been a couple of months now, actually, since we last talked, and things certainly have changed in the COVID world. How has campaigning been going for you?
Campaigning has been going great. We are building a ton of momentum, and this summer we have really felt that momentum and that wind in our sails as we have been getting out there at rallies and vigils for Black Lives Matter protests, making sure that we're connecting with voters all across the district. We have a series of events that are planned for the next few days to get us all enthusiastic and excited to get out there and vote on or before September 1st.
Yeah. Do you find that there's a different energy in the campaign now that you're able to have some in-person events?
There is. It's really wonderful to be able to see people face to face, even with 6 feet of difference and a mask on and all of those restrictions that we have in place. People that I met in March and April online on Zoom calls, who I now get to connect with and see. There's just a different energy that happens.
Is there also a different platform that you've taken on over the past couple of months, something that you think is more urgent that maybe wasn't at first?
Well, I will say I've been talking about racial justice from the beginning, from November when I launched the campaign. It's part of the plans and the policies that I'm putting forward in the campaign. It's certainly taken on more urgency in the past few months as the whole country has had this very difficult conversation around racism that exists and how we move forward. That is certainly, I feel that in every campaign stop, in every forum we do, in every Zoom call, there is this constant thread of talking about equity and justice and how we can move forward with that. But there's also another piece that's happening, which is that there's an incredible enthusiasm to see change. And we were feeling that on the ground back in January and February when we could campaign out in person. It was building in the spring, but over the summer, I have really felt that overwhelming desire for change across the district. And that's been really buoying us and supporting us as we go into this last week of the election.
Yeah. What can you attribute that to? Anything maybe that's going on now in Washington, or with the pandemic, or with the economy, or
yeah. I think it's a lot of things, right? I mean, it's certainly folks recognizing that we are still living in this pandemic 6 months later, right? We're still struggling. I can tell you in the hospital, we're still working through what we do with limited PPE, what we do with limited testing, as people are thinking about going back to school, either K through 12 or college. People are thinking about what limitations are in place because the federal government hasn't been able to activate around what we need. We are all seeing the growing numbers of cases and deaths that are happening every single day. That has created some of that urgency for change, some of that understanding that we've got to get the right people down to Washington so that we can move forward with the plans and the policies that are going to make ourselves, our society, our communities healthier.
Yeah, and for folks who might not know, you are an infectious disease doctor at Mass General Hospital, so you are literally one of the first responders in the front lines of this pandemic. And I know last time we talked, you had said how evident it was that the pandemic really revealed a lot of disparities when it comes to society, to socioeconomic status, and to race.
Yeah, I mean, we're still seeing that, right? Let's just take for example, Brockton, which is the southernmost part of the 8th Congressional District. Brockton has seen increasing numbers of cases again. Quincy has seen increasing numbers of cases, right? The state has put out these yellow and red and green designations. I believe Quincy this week is a yellow city and Brockton is a red city, suggesting that they have high enough cases that we need to be concerned. Those cases are happening in communities of color. They're happening in very specific areas of the district. And those racial inequities and the lens of racism that plays out, that we can see all of this through, it's been there since the start of the pandemic. It was there long before the pandemic. I think we're so aware of it right now, and we have a lot of work to do to address that underlying racism.
So what policies do you think need to be changed? Which ones need to be eliminated? What new policies need to be created to address those issues?
Well, I think, we have to think about systemic racism in every policy. I don't think there's a single federal policy or state or municipal policy that can't specifically and intentionally address race. But in particular, right now, I think the two biggest things that I think about when it comes to racism and inequity are, one, healthcare coverage and access to healthcare for communities of color across the district and all across the country, and access for businesses to survive and to thrive through this pandemic, and specifically minority-owned businesses. If we talk about healthcare first, we know that in this country, even with the Affordable Care Act in place, Black and Brown communities are the communities that are less likely to have health insurance. And as the pandemic hit, they were the communities that were hardest hit by the virus. So we've got to make sure that we're investing in that healthcare space, that we are rapidly expanding coverage for those communities. We are investing in a Medicaid expansion. We're investing in reopening the exchanges. We're investing in the community level work that it's going to take to get those people signed up for insurance so that they're protected during the pandemic. And the other piece, that business piece, is about making sure that the federal government, when they go to invest in small businesses and go to invest in the American worker, that those investments are going to minority-owned businesses all across the 8th Congressional District where they exist, but also all across the country, to make sure that they can actually survive through this pandemic.
In your view, what mistakes has the current administration and Congress made in this crisis?
Well, if you look at PPP, the Paycheck Protection Program, which was a huge boost to the American economy in many ways, and really was aimed at protecting folks who maybe needed unemployment insurance, or making sure that people could continue to be paid from their job, even if the work wasn't there to do. That was a program that got pushed out without really any understanding of how it was going to improve the lives of minority-owned businesses, of women who are in business, of Black and Brown business owners. And I think we have an opportunity with the next set of funding to be very intentional. I'll give you an example of that. In the HEROES Act, and in the current, sitting in front of the current Congress right now, there's a piece of legislation called the Restaurant Act. The Restaurant Act is there to shore up support for the restaurant industry. And they specifically put into that legislation that the first 14 days of the program are going to be open to minority-owned businesses and small businesses and communities, because we want to make sure that those folks get an opportunity to access that funding. I think that the federal government missed an opportunity with PPP to do the same thing. And I think right now, I don't see the legislation other than the Restaurant Act in the HEROES Act that is very specific and intentional around minority-owned businesses.
So how will you be able, if elected, to work across the aisle, with Republicans in control and get legislation like that passed?
Well, I'll say first, I'm hopeful that in January of 2021, we'll have a democratically controlled Senate and a further majority of Democrats in the House. So I think it's going to be a lot easier than it is currently, just based on those numbers. But I think part of what I have been talking about in this campaign trail is stressing the urgency of this crisis. Congress recessed. They came back this weekend to pass the bill to support the Postal Service, but are now back on recess and are heading back home. And while they're home, while they're enjoying their summer vacation, the American workers and American small businesses are shuttering their doors. People are about to face another rent check that's due on September 1st. People are getting infected with COVID, and people are dying from COVID, all while Congress, the House and the Senate, are on recess. I think we've got to recognize that is no longer sustainable. It's time for the federal government to really act responsibly and act in a way that will support all Americans.
Speaking of the aid package for the Postal Service, I know you're part of a lawsuit with regards to that, to try and stop the reforms that are happening that seem to be impeding the flow of mail.
Yes. Yeah. Well, I think there's a lot that needs to be done for the longevity of the Postal Service, and that aid package that came out of Washington is talking about just that, making sure that we fund the Postal Service appropriately, that we get the sorting machines back into post offices all across this country. But the lawsuit that you're referencing is specifically around what's happening right now when it comes to voting rights and access to the ballot. I will just take a bit of a detour and say this is something we've been talking about for much of the campaign. Back in April, I filed a lawsuit against the state because of restrictions on voting rights because of COVID-19. And now there is another case brought by Becky Grossman, a candidate from the 4th Congressional District, that is really challenging the state and saying COVID-19 and the current postal crisis is making it incredibly challenging for people to vote safely, either by mail or in person. And so we've got to make some adjustments to how we collect ballots and when people can send those ballots back. And I wrote an amicus brief, a supporting letter to the court to say, as an infectious disease doctor, I fully support people voting by mail and making sure that access is available. As a candidate, I want to make sure that every vote is counted. And as an American, I think it is our job to make sure that democracy happens here. So it was really important for me to write that letter and to support this court case.
The current incumbent, Congressman Lynch, was seen lambasting the Postmaster General. How would you kind of rate his performance during that committee hearing?
You know, I would say I can pound my fists as well. I can scream loudly. And I think that that's what we saw yesterday from Congressman Lynch in Washington. What I'm trying to do with this campaign is to take action. Our case against the state that went to the Supreme Judicial Court, and I'll note one, was taking action. That court case is now used as precedent, and it's part of what is driving this court case that's currently in front of the Supreme Judicial Court. I think it's time for action on these issues. We've had time to yell and to scream, to pound our fists, to write letters. We've got to actually do the hard work of guaranteeing everyone that right to vote, access to vote, to make sure that their voices are heard.
The 8th district, as you're well aware, is quite diverse from the urban areas where you live, right in Boston, as you mentioned, down to Brockton and even sections of suburbia in the southwestern part of the state. So how do you address the needs of each individual community?
Yeah, I mean, it's a really, really diverse district. It's a huge district, 24 cities and towns, but there are common threads that go throughout all of those cities and towns. They are all cities and towns that are feeling the immediate impact of climate change, certainly along the South Shore, but also down in Brockton and in some of those western suburbs that you described, like Dedham, Walpole, and Norwood. They're all cities and towns that are looking for healthcare expansion and to make sure that we are moving in the right direction with healthcare. The way that I connect with folks is that we find those common threads and we bring everyone together around those issues. I have to say that, the Black Lives Matter movement, these rallies and vigils, this push for racial justice has also brought this community together. I've been to countless vigils and rallies in almost every city and town of this district. And every time I go, I am impressed by how many people from that town are showing up and from the neighboring towns. It's brought people together, and it has really shown us that we are one community here in the 8th district.
Do you condone some of the violent acts, though, that have taken place at some of these rallies and some of the vandalism and some of the hatred and bigotry that's come out of them, too?
Yeah, so, I mean, I certainly don't condone the violence that is happening. There has been violence even here in Boston. We as a campaign released a statement about some windows that were broken and some vandalism that occurred in Beacon Hill, where there were Black Lives Matter signs in the windows. And, I think that this community, this district, this state has no place for hate and no place for those types of acts. We can do this peacefully. And we have largely done this peacefully. We can do this by using our voices and saying what we mean and what we need in this country, which is racial justice, and to ensure that Black Lives Matter. I certainly do not want to see the violence that has happened all across the district.
Sure. Is there a figure in history, Doctor, that inspires you when it comes to these matters of social injustice and race?
Yeah, well, I get asked this question a lot. I get asked both is there someone living and someone dead in public life that I think about and that I look at as a hero? And I will say, I always have the same two answers. I'll give you both. The living person is Congressman Lauren Underwood from Illinois, which many people actually don't know, but I'll encourage people to look her up. She's a freshman representative, a public health nurse, an incredible advocate for healthcare expansion, voting rights, racial justice. She's been on the right side of everything in the past 2 years in Washington. So people should look her up. But the person in history that I oftentimes bring up is LBJ.
Hmm.
And it's, I acknowledge that there are things that he did that I disagree with. The Vietnam War is one of them. But I do think that his drive for racial justice, his drive for progressive change, his ability to form coalitions, get things through Congress, and get them on his desk when he was president and signed and brought into law. I think that type of work, we need to go back to that type of Washington, where you can actually achieve real change just by building that really broad coalition.
Has foreign policy kind of taken a back seat, in this election? It started out the year as maybe one of the top issues with the immigration reform and relations with China. Haven't heard much about that lately. What do you think?
Yeah, I mean, I think it's still an issue, and it's still something that I certainly talk about on the campaign. I mean, I talk a lot about the size of our military budget and the need to shrink that budget to make sure that we are spending our money wisely. Talk a lot about the State Department and how it's been decimated over the past 3.5 years under President Trump, and the need to reinforce our State Department and bring in more diplomats around the world. I certainly talk a lot about immigration and what is happening along our southern border, in detention centers here in the United States, the failed policies of the Trump administration. Even though COVID-19 has been in the headlines for 6 months, we can't forget that those things are still happening on our southern border, that people are still coming here seeking asylum and are oftentimes detained. They are victimized, they are marginalized in our own borders. And I am running to make sure that we keep having that conversation. I say a lot, we can walk and chew gum at the same time. I'm pretty sure that we can do many things as a country. We don't have to just focus on one thing. We can focus on many different things because there's a lot that we're going to have to fix, a lot that we're going to have to address in January.
One thing I think we did learn as a result of this is the whole issue of supply and demand and supply chains and the way things are manufactured and delivered. What did you take from that, and how do you think those should be improved?
Yeah. Well, I took from our experience over the past 6 months that the federal government has really failed us in that process. That for so many things, not just PPE, but also testing for COVID-19, the federal government could have stepped in and played a tremendous role in making sure that the supply chain was shored up. We don't talk about this a lot, but one of the concerns around testing availability is not just the capacity to run the test at various facilities. It's that we don't have the supplies to do the test. We don't have the swabs for people's noses. We don't have the tubes to put the swabs in. We don't have the liquid that we have to carry everything in. Those are real constraints on our capacity to be testing enough people in this country. And it's 6 months into this pandemic. There was no reason why the federal government shouldn't have invested money and resources in organizing and coordinating the supply chain that we needed to make sure that we could move forward.
The argument was that things are mostly manufactured overseas. Do you think that's not the case?
Some things are for sure, but a lot of things are manufactured here. I can tell you what we did at Mass General. So what we did at Mass General is that we went to multiple different suppliers and multiple different places and said, we're going to create our own kits. We're going to create our own ability to do all of these tests, right? But we shouldn't have had to do that as a hospital. Instead, the federal government should have been able to say, well, we've got this company here in Indiana and this company in Massachusetts, and we've got a place over here in Florida. We can bring all of these pieces together and make sure that we're distributing things. There are a lot of supplies that are made overseas, and that became more challenging as the pandemic continued. But there are many things that are manufactured right here in the United States, and the federal government could have had a much bigger role in coordinating things.
Here we are, just a week to go before the election. What is your agenda, your strategy, if you will?
Well, we're going to do what we've been doing since the start, which is that we're going to talk to every single person that we can all across the district. So we have a series of events planned between now and Election Day that include socially distant and mask-wearing outdoor events so we can bring people together and rally a bit. We've got virtual events that are happening every day to make sure that we continue to introduce me to people across the district. And we got a lot of forums and series that that I'll participate in to make sure that the issues are still part of this campaign. But our goal each day is to connect with more people than we connected with the day before. And that's how we're going to march from here all the way until September 1st.
Is being a doctor, and specifically an infectious disease expert, helping you? Obviously, you launched your campaign before there was ever a COVID-19 pandemic, but here we are in the midst of it now.
Yeah, well, I have to say, I think it is helping. I think people do recognize the opportunity here. They recognize that they have an opportunity to elect the only infectious disease doctor to Congress in the middle of a pandemic, and that I bring quite a unique experience and expertise to Washington. It does have its downside, I guess I'll say, is that I'm very strict with my campaign about hand washing and mask wearing and physical distancing and the way that we're trying to keep ourselves safe. I think we've got to make sure that we're doing everything we can, each and every one of us, to make sure that we are stopping the spread of this virus. But overall, I think it's a positive for the campaign.
I think I'd asked you this before too, is if you are elected, would you continue in your role as a physician at Mass General?
I will continue to be a physician. I will hopefully continue to see patients. I think I won't be able to be a primary care doctor in the way that I am for many people at Mass General. It's too hard to be a primary care doctor and not be available every day of the week for folks and be here in the state. But I do intend to continue to connect with my patients. I think that's the whole inspiration for this campaign, right? Of hearing from my patients what's going on in their lives, the stories that they share, the challenges that they're facing. And I want to make sure that I continue that connection once elected.
Yeah, I'm sure one of the biggest concerns right now is sending kids back to school. How would you kind of rate how the federal government has issued guidelines for that, and what would you do differently?
Yeah. Again, I'll say this is another area where I see the federal government really failing, and the federal government not giving very clear guidance. We hear from the president and his administration one thing, we hear from the CDC another, we then see people change their minds in both sides of that argument. We don't have clear federal guidelines on how best to reopen schools, both the K-12 schools and colleges. And it's been left in many ways to states and to municipalities to figure out how to do this safely. I think that there are a lot of concerns about going back to school. Will there be enough testing? Do we have enough of a public health infrastructure in place that if someone tests positive, we can do the contact tracing and the information gathering that we need? What happens if we get 2 months in and we have a second wave of this? And how do we transition rapidly to virtual learning if people are doing hybrid or in-person learning? We don't have all of those answers because the federal government hasn't stepped up to the plate and really given us what we need to get through this.
There's been talk about eliminating the Federal Department of Education. Actually, would you be in favor of that?
I would not be in favor of eliminating the Department of Education. I think there's an enormous role that the Department of Education plays, certainly in COVID-19 and making sure that we have safe policies in place to keep our kids and educators safe from this virus. But there's also a much broader role for the Department of Education, and let's put it into the context of what we were talking about earlier with racial justice. As we're moving forward and creating curriculum that are explicitly anti-racist, it's going to take the federal government and the Department of Education to make sure that that's implemented all across the country. It's implemented in culturally competent ways in different communities and different states, but we've got to rely on the federal government to help coordinate that effort.
Anything else we should touch on right now, Doctor?
I don't think so, other than I'll say for people who are watching or listening that I ask for your vote on or before the September 1st primary. We've got, as of this recording, 7 days left. And so if we already have your vote, go out and tell 10 of your friends to vote for me. But if we don't, learn more about me at robbieforchange.com, and hopefully I'll earn your vote.
All right. Appreciate your time, Doctor. Great to talk to you.
Great to talk with you as well.
Bye-bye.